All right, welcome back. Today we're going to talk a little bit about arthritis. We're going to talk about what it is and what it isn't. Arthritis, or at least osteoarthritis, is not a true inflammatory disease. Okay, it's not something that's genetic, such as rheumatoid arthritis. Rheumatoid arthritis is where the body actually attacks the joints, and therefore it is an actual inflammatory disease. But osteoarthritis has to do with wear and tear with time. Okay, now usually by the time we've gotten old, we've had enough time to appreciate wear and tear. But last time I've checked, from head to toe, all of these came out at the same time, right? And only certain ones are arthritic, meaning that they've gotten more wear and tear, such as maybe the L5 and sacral joints, such as your C6 and 7. Those are the ones that tend to wear out more so than the others. But that's why certain ones will wear out versus other ones. They all have the same birthday, so if it was age, they would all have the same amount of arthritis as well. So there's a part of that. Also, the reality is that joint range of motion is very important when we're considering that wear and tear. Okay, this is why chiropractic is very, very helpful. What we're going to do is we'll go in there, we'll adjust the segments, we'll restore that joint ranges of motion, and by doing so, that'll help the joint stop the arthritis, because that joint range of motion is responsible for nourishing those joints. It's going to be delivering the nourishment in there. It's going to be removing toxins out. So it's very important that we have proper ranges of motion, and that we're not having our body's not stuck trying to look that way, that we have complete ranges of motion, so that we don't have to have that. Another thing is, as the joint range of motion's down, it wears harshly and unevenly. Okay, that's exactly what's happening in most people's cases over time. Okay, again, when we get older, we've had enough time, and that's the biggest problem. But the beauty is, chiropractic helps with that. It helps with decreasing the amount of disc degeneration. It also helps increase that joint mobility, and it actually helps kind of eliminate and or stop the progression of the arthritis. Okay, taking a look at the vertebra and the disc, what we have here is that when we're getting that wear and tear up in here on that disc and it's rubbing really hard and unevenly, that tends to thin this disc out. And as it thins out, it can also cause the disc to become bulgy in the back, and that can cause pressure on those nerve roots. So that's what arthritis can do. But as the body also causes stress, much like going out and gardening, when we go out and garden, we get calluses on the hand. That's kind of what happens with the bone spurs. As we have that uneven wearing and tearing, we usually end up getting bone spurs right here on the front ends of the vertebra, and also here in these little holes here, because it's rubbing so hard, and that's that body's response to that stress. Okay, so that's part of the arthritic process right there. Here's one more thing here, and to consider, because most people think that arthritis is the cause of the problem. Okay, it's the rubbing and the wearing and tearing with time that is, or the motions that we're doing. Arthritis is a symptom. Okay, it's there with the pain. It's a symptom of it, but you can have arthritis and not have pain. So the reality is that it's not the source of pain. It just happens to be there with your pain, and we're able to appreciate that when we take X-rays, for example. But a couple of misnomers. Hopefully, we've straightened out some of those. But increase the joint range of motion. Chiropractic really helps out with that. We're here for you. We're your partner in health. All right, guys, take care.